Hey everyone, and welcome back for another deep dive. Today, we're going to be looking at frontotemporal dementia.
FTD.
FTD, yeah, you got it.
Yeah.
You might have heard about it recently with the diagnoses of Bruce Willis and Wendy Williams.
Right?
It's a type of dementia that's been getting more attention.
Yeah, it's definitely been in the news a lot lately.
Absolutely. And we've got some fascinating new research to unpack straight from the University of Western Ontario about a particularly challenging symptom of FTD.
Apathy.
Apathy.
Yeah.
So before we get into the, the details of the research, can you give us a quick rundown on FTD? What makes it different from, say, Alzheimer's?
Sure. So FTD primarily affects the frontal and temporal lobes of the brain.
Okay.
These are the areas that are responsible for things like personality, behavior, language, and decision-making.
Gotcha.
Alzheimer's, on the other hand, initially impacts memory more significantly.
So with FTD, we see more changes in behavior and language than just memory problems.
Exactly.
Okay.
Individuals with FTD might display impulsive behaviors, changes in their eating habits, difficulty with language, or emotional withdrawal.
And this is where apathy comes in.
Precisely.
Okay, so apathy in this context isn't just feeling a bit lazy or unmotivated.
No, you're right. It's much more profound than that.
Okay.
Imagine losing the desire to do the things that you once loved.
Right.
Even those simple things that brought you joy.
Yeah.
Or feeling emotionally distant from your loved ones, even your pets.
Oh, wow.
It's a real struggle for those affected and their families as well.
Yeah, that paints a pretty stark picture. The research actually mentions some specific examples, right?
Yes. The researchers included some poignant anecdotes from caregivers.
Okay.
For example, they described patients neglecting to call family members.
Wow.
Or forgetting to do everyday things that show care, like making their spouse a cup of coffee.
Oh, geez.
It really emphasizes the significant emotional toll that apathy takes on everyone involved.
Yeah, it's heartbreaking to think about. So let's get to this new research. They're using something called oxytocin to try and treat apathy in FTD. I have to admit, when I first saw love hormone being used to treat dementia, my curiosity was definitely piqued. What can you tell us about this study?
Well, what's fascinating about oxytocin is that it's a hormone that's produced naturally in the brain.
Okay.
And it plays a crucial role in things like social bonding, empathy, and trust.
Gotcha.
The researchers theorize that boosting oxytocin levels might help reignite those lost emotional connections in FTD patients.
So they're essentially tapping into the brain's own chemistry to combat apathy.
Exactly.
Okay.
And this wasn't just a small experiment either. This was a large-scale, rigorous trial, actually the largest of its kind for FTD treatment.
Wow.
It involved 74 patients across various centers in both Canada and the U.S.
Okay, so this was a pretty big deal. Then how did the researchers actually administer the oxytocin?
They used a nasal spray, which patients received every third day for a period of 6 weeks.
Interesting. A nasal spray seems surprisingly simple for such a complex condition.
Yeah.
And how did they track any changes in the patient's apathy levels?
They used a standardized questionnaire to meticulously track any changes throughout the study.
Okay, so a nasal spray and a questionnaire.
Right.
So they had a solid system in place to track any potential improvements. So how did the patients actually respond to this oxytocin treatment?
Well, this is where it gets really interesting.
Okay.
This was the first study to demonstrate a statistically significant improvement in apathy levels in FTD patients.
Hold on, significant. That's amazing. Are we talking about a cure here?
Now, it's important to manage expectations.
Okay.
The researchers themselves described the improvement as mild, so it's not a complete reversal of apathy.
You know, you mentioned mild a couple of times. Now, I'm curious, for someone with FTD, could you explain why even a mild improvement would be considered significant?
Sure. You see, for someone struggling with FTD,
Yeah?
even a slight increase in motivation and emotional connection can make a world of difference. It could be the catalyst for reconnecting with loved ones, even if it's just for a moment. Rather than remaining isolated and withdrawn, it can truly be transformative.
That makes a lot of sense. It's not about monumental changes, but about those small, meaningful steps forward.
Absolutely. It's about reclaiming those precious moments of connection and engagement that are often lost in the fog of FTD.
So did the researchers share any specific examples of how this mild improvement actually played out in the patient's daily lives?
They did, and this is where those anecdotes from caregivers become so powerful.
Okay.
They reported that some patients started initiating phone calls to family members, again, something they hadn't done in quite a while.
Wow.
Others began making those small gestures of care, again, like offering to make coffee for their partner.
Wow, that's incredible. It really highlights how even small shifts in behavior can have a ripple effect, bringing those moments of connection back into people's lives.
Exactly. And remember, these were changes observed after only 6 weeks of treatment.
I can see why you're excited about this study. What makes this research so important in the bigger picture of FTD treatment?
Well, it's the first time we've seen any kind of meaningful improvement in apathy in FTD patients.
Okay.
Until now, treatment options have been extremely limited, focusing primarily on managing symptoms rather than addressing the root cause.
So is this considered a game changer for the entire field of FTD research?
It certainly has the potential to be.
Okay.
This study could pave the way for developing new therapies that target specific symptoms like apathy and ultimately enhance the quality of life for individuals living with FTD. It's really quite exciting.
I have to admit, I am getting pretty excited about this too. I'm really curious to hear more about why this research is so groundbreaking. But first, we need to take a quick break. We'll be right back with more on this fascinating deep dive.
Yeah, it really is a shift in how we think about it,
Yeah.
This research is suggesting that maybe, just maybe, we can restore some level of function in FTD patients.
Yeah.
Even if it's not, a complete cure.
Right. And that's a really important point. It's about focusing on what's possible, on improving quality of life, even in the face of a devastating diagnosis.
Exactly. And this study with oxytocin opens up so many possibilities.
Yeah.
It's not just about treating apathy.
Right.
It's about understanding those underlying brain mechanisms and how we might be able to influence them.
It's amazing to think that something as simple as a nasal spray could potentially have such a profound impact on someone's life. It really speaks to the power of scientific research and the dedication of people like Dr. Elizabeth Finger, who led this study.
Absolutely. Dr. Finger has dedicated over 15 years to this research, driven by a deep desire to help those affected by FTD.
Wow.
She was inspired by conversations with caregivers who shared their desperate need for treatments that could help manage, the really challenging symptoms of the disease.
Yeah, hearing stories like that really underscores the human side of research. It's not just about data and statistics.
Right.
It's about real people facing incredibly difficult challenges.
You're absolutely right. And it reminds us that research is not just about finding a cure, but also about alleviating suffering and improving quality of life for those living with these conditions.
All right, so we've talked about the potential, but let's be realistic here. This is still early stage research, right? We need to be careful about overstating the findings.
You're absolutely right to be cautious.
Yeah.
While the improvement in apathy was statistically significant, as I mentioned before, it was still in the mild range.
Right.
We need more research to confirm these findings and to explore the long-term effects of oxytocin treatment.
Yeah.
It's important to be transparent about those limitations.
Right, and scientific breakthroughs don't happen overnight.
Exactly.
It's a process.
It is.
And it's important to keep that in mind.
It is. And this research raises some interesting questions about how we approach dementia treatment in general.
Okay.
Traditionally, the focus has been on finding a cure.
Right.
But what if we shifted our attention to managing symptoms and improving quality of life?
That's a really interesting question. It's almost like a paradigm shift in thinking about how we care for people with dementia.
Precisely. And this study with oxytocin suggests that such a shift is possible by targeting specific symptoms like apathy. We can make a real difference in the daily lives of those living with FTD.
It's amazing to think about the possibilities. This research is like opening a door to a whole new way of thinking about FTD treatment.
I think that's a great analogy. We're really just at the beginning, We're just scratching the surface of what's possible.
But this isn't just about medical interventions, is it? It's also about providing support and understanding for the families and caregivers who are on the front lines of this disease.
Absolutely. They are the unsung heroes in this battle. The emotional and practical challenges they face are immense, and we need to do more to support them.
This deep dive has been truly enlightening. We've learned so much about FTD, the challenges of apathy, and the potential of oxytocin to make a real difference in people's lives. But what I find most compelling is this shift in focus from finding a cure to improving quality of life. It's a subtle but profound change in perspective.
I completely agree, and it's a message that we need to keep amplifying.
Yeah.
We may not have all the answers yet, but we're learning more every day.
Okay, before we wrap things up, I want to leave our listener with something to think about. This study focused specifically on apathy.
Right.
But it begs a broader question. What other FTD symptoms might be treatable with similar approaches?
That's a great question, and it's one that researchers are actively exploring. Yeah. This study has opened up a whole new avenue for exploring symptomatic treatment in FTD.
So there's a lot of hope on the horizon.
Yeah.
It's not just about managing the decline.
Right.
It's about finding ways to help people thrive even in the face of FTD.
And that's what makes this research so groundbreaking. It's not just about treating a disease. It's about restoring hope and possibility.
Yeah, it's like this research is shining a light on new possibilities, new ways to think about FTD and how we can support, those affected by it.
Exactly. And it's not just about the patients themselves. It's about their families and caregivers as well.
Right.
Imagine the relief and joy that even a small improvement in apathy can bring to those who are caring for their loved ones day in and day out.
You're right. It's about those moments of connection, those glimpses of the person they know and love shining through.
Exactly.
Those moments can be so precious, especially when you're facing a disease like FTD.
Absolutely. And this research gives us reason to believe that those moments can be more frequent, that we can help families create more of those positive experiences.
It's all about finding those glimmers of hope, isn't it?
Yeah.
Even in the face of a challenging and often heartbreaking diagnosis.
Precisely. And this research is a powerful reminder that we should never give up hope, that there's always more to learn and discover.
This deep dive has been incredibly insightful. We've gone beyond the headlines about Bruce Willis and Wendy Williams and really explored the complexities of FTD, the devastating impact of apathy, and this incredible new research using oxytocin.
And you as a listener might be thinking about someone you know who's been affected by FTD.
Right.
It's important to remember that you're not alone. There are researchers, clinicians, and support groups out there dedicated to helping families navigate this challenging journey.
That's such an important point. There are resources available.
Yeah.
And there's a whole community of people who understand what you're going through.
And research like this gives us reason to be optimistic. It's a reminder that progress is being made, and there's hope for a future where FTD is no longer such a devastating diagnosis.
Exactly. We might not have all the answers yet, but we're definitely moving in the right direction, and that's something worth celebrating.
So to our listeners, we wrap up this deep dive. We encourage you to stay curious, stay informed, and stay connected with the FTD community.
There's power in knowledge, and there's strength in community. Keep learning, keep exploring, and keep those glimmers of hope alive. Thanks for joining us on this journey of discovery.